I'll ask Dr. Nsiah Asare to come forward. He's the Presidential Advisor on Health to the Office of the President of Ghana. Dr. Anthony, please.
Thank you very much, John. I want to bring greetings from His Excellency, the President of the Republic of Ghana, who would have loved to be here for this lunch, but due to unforeseen circumstances, is somewhere in the UN. Ghana welcomes the SDG goal of hepatitis elimination by the year 2030, and it continues to grapple, as it will continue to grapple with the hepatitis problem. A recent study in Ghana brought attention to the inequalities in disease burden and access to testing and treatment. Hepatitis has the potential to undermine the huge investment government is making towards achievement of SDG goals. Solidarity with Gavi and other partners has enabled Ghana to attain 98% coverage of hepatitis B containing pentavalent vaccine in 2021. We've also done a lot in blood transfusion standards, and also standards for infection prevention control remain very high. The government is supporting ongoing studies towards birth dose implementation by the Ghana Health Service and US CDC, and towards a triple elimination agenda by the Office of the First Lady through the Ghana AIDS Commission. The Ghana Association for Study for Liver and Digestive Diseases is also piloting the centralized hepatitis care in some selected districts in Accra, which we hope to scale up in the other parts of the country. And I'm also very happy to also add my voice and announce and thank Egypt that the cooperation between Ghana and Egypt to screen and treat about 50,000 hepatitis C patients. And I'm happy to say that the first dose of the medicine is in country and is undergoing the necessary regulations and registration. I'm confident that the conciliation of all these efforts will lead to accelerated response to the elimination challenge. Whereas only 1 in 4 patients with hepatitis C are aware of their infection, and only 1 in 10 persons with hepatitis B are receiving care and treatment, and about 1 in 5 newborns in Africa receive timely doses of hepatitis B vaccine, and also recognizing the United Nations has called on the world to combat hepatitis, with goals for elimination of hepatitis B, especially in young children, and recognizing that we have effective vaccines, reliable tests, and curative treatments are now available to eliminate hepatitis. Our government in Ghana has resolved to accelerate progress towards the UN and WHO goals for hepatitis elimination, and also to overcome the inequities in health. Ghana, therefore, is very happy and willing to join the UN group of friends to eliminate hepatitis. And we further resolve that this cooperative effort of the UN group of friends to eliminate hepatitis should include sharing information on progress, innovation, and experience and lessons learned among member states, as we are doing with Egypt, and organizations within the UN system with other stakeholders. And also, it should serve as a forum to develop UN resolutions and calls for action for help, especially for low and middle income countries to eliminate hepatitis. And we should also be able to bring high level attention of donors, development banks, and philanthropic organizations, and promote health diplomacy, as we are doing with Egypt, between member states and other organizations to build a national and global capacities. On this note, I'm very happy to say that Ghana is very willing to be a member of this UN group of Friends for Elimination of Hepatitis, and we call on all other nations to join suit. Thank you for attention.